In this casket being lowered to the ground lies the body of a child Flavia, a 16-year-old girl who died from cancer of the bone. 2 years ago, at the age of 14, Flavia was a healthy girl whose dream was to become a doctor, but all that was ruined when she was diagnosed with cancer. Her mother took her to the hospital. However, the cancer had already spread and destroyed her organs. Flavia's case is but just one of the many cases of cancer in children in Uganda.
And one of the common cancers we have is called Burkitt's lymphoma. Burkitt's lymphoma is a childhood cancer. The good news is that it is curable if it is detected early. And 80% of our children in the northern part of Uganda actually have cancers called Burkitt's lymphoma. It is a cancer that affects the white blood cells. And then another cancer that also is common in children is leukemias and then nephroblastomas. These are the three common cancers in children.
9-year-old Otema Raphael and 12-year-old Lakes Govia are among the many children suffering from cancer in northern Uganda.
From 2014 up to now, about 200 children have already been diagnosed with different types of cancers in northern Uganda. And the good news is that between 70 and 80% are Burkitt's lymphoma, which is curable, meaning that about 70 to 80% of these childhood cancers, if they are picked early, they can be cured, and then the children grow up to adulthood without any problem.
With increasing cases of cancer among children in Uganda, many has failed to access immediate medical assistance due to misconception, lack of awareness, and poverty, which render families unable to afford medical expenses. Much as there are only a few hospitals that treat cancer in Uganda, many partners have blamed government on failure to sensitize communities about the disease.
Most people in the community still think that cancer may be related to maybe some evil spirit, maybe someone has been bewitched, or maybe someone has been poisoned. So it is affecting the fight against cancer in children in such a way that before even coming to the facility, they first go to the witch doctor, they first put some traditional herbs, until when the cancer is advanced, and that's when they come to the hospitals. Yeah. Another challenge we have is lack of keeping appointment. I mean, the default treatment, you start chemo, like for Burkitt's lymphoma, they need to undergo 6 cycles of chemotherapy. And so these children, sometimes they receive the first chemotherapy, and then when the cancer shrinks, they now go home, they don't come back for the second, the third, fourth, fifth, and sixth chemo. So usually we have cases of missed appointments, so many of them, and most of the children who would have actually completed treatment and get cured.
Moved by the pain that her father, a cancer patient, has been going through since 2016, Achiruchan Immaculate Owero wondered what kind of pain and suffering those children with cancer and their families undergo. It is the reason she has established a local non-governmental organization called Future Hope Uganda, whose work is dedicated to ensuring that children with cancer are treated at earlier stages, affected families are supported, and awareness is created among communities.
I come from a family where my dad is suffering from cancer. He goes through a lot of pain. He's an old man who is now 84 years. The pain that my dad goes through, the expenses that the family members meet in terms of medication, transportation to Mulago on monthly basis, diet, and any other expense that the family members meet. And then when I look at the other side, an old man crying in pain, I always ask myself, what about these young children who are down there in the community and they suffer from the same cancer? How much pain do they go through? This really inspired me to open up a community-based organization called Future Hope Uganda.
Despite efforts by Future Hope Uganda, there are a lot of misconceptions among members of the communities about cancer, which makes it difficult for both organizations, such as Future Hope Uganda and doctors.
Due to limited fundings, Future Hope cannot fully meet its aims and objectives of sensitizing the community about cancer, reaching out with a sustainable livelihood project to these families that are affected with cancer, meeting a logistic support to these children to bring them from home to access treatment from the hospital.
While children with cancer continue to bear the physical pain associated with the sickness, their family members are also affected in one way or another. Lakay Dora, a 68-year-old grandmother to her child Flavia, was left to take care of 6 other children when our daughter, Flavia's mother, had to attend to Flavia at hospital. Future Hope Uganda, after realizing the burden that families of people with cancer undergo when their breadwinners has to take care of the sick in the hospital, thought it wise to help such families. With inadequate capacity to help many, Future Hope Uganda relies on friends and well-wishers to support as many cancer patients and their affected families as possible. Joseph Amanya is one such friend.
One is that I've seen that all these institutions are working towards supporting victims and patients of cancer. But there is disconnect among this organization and in their operation. You find Future Hope Uganda is doing an outreach on cancer, doesn't have capacity in terms of monetary or the human resource. And therefore it becomes a bit challenging to reach outside there. So Future Hope Uganda should establish a communication link between they as an organization and hospital institutions that deliver medical assistance to victims of cancer. I know Future Hope deliver services like helping the families of the cancer victims and also sensitizing them. But they need to take over the management issues of cancer, because as a child suffers from cancer, services alone are not enough, but a management issue. How does an organization like Future Hope Uganda manage or support the family to manage an early stage of a cancer in a patient? Secondly, the medical institution need to establish a direct connection with this institution and keep them informing them about hotspot of cancer, and actually establishing a link that if organization like Future Hope Uganda gets a cancer person, this person should be immediately reported. We know you can look at cancer itself. The physical pain is with the patient of cancer, but the traumatic experience is with the family. And this is one of the serious things that I noted, because you can see that the family of this patient are actually going through painful experience of either having thought of losing that person of theirs in the nearest future, or having a thought of being vulnerable that they cannot help this person to the road of death, to stop this death, and having a thought that now all the resources they have, they are going to invest in ensuring that this person comes out.
The challenges are immense, but with generosity from friends of Future Hope Uganda and well-wishers, children such as Flavia and many out there will not be dying of cancer, because the cancer in them would have been detected earlier, and communities would readily come out to tackle cancer in children heads on.
Wadi na ma per wan ko beda char tuma gwina wa char tuma pe ke gi moy kana mi a ko ke ale ga giramo kanya ga ma giramo tar gi ma bor